Okay, now I'll call to order the regular agenda. The regular meeting of the Watsonville Community Hospital Board of Directors for Wednesday, November 19th. Rosie, if you can, please give us a roll call.
Yes, Director Cox, Johnson, Director Friel,
Here.
Director Gallagher,
Here.
Director Pimentel,
Here.
Attorney.
Here. There's nothing to report out of tonight's closed session, and so I'll move us forward to the agenda modifications for consideration from staff. Seeing none, I'll move us on to public comment on matters not on tonight's agenda. Anyone, please?
So Jennifer Gavin, I'm with pharmacy and with respiratory therapy. I put flyers kind of near both of your guys' areas because good things and I wanted to brag. So the one that looks like a kid in a stocking is a kid in a stocking. So Dr. Osgay Delvin, who's one of our pediatricians from Packard, is going to host the first annual intensive care nursery graduation party, December the 11th, from 1 to 4 in the lactation room. So they're partnering with, I think Packard or Stanford provided some funds for some gifts and things, and then the foundation is providing some money so that they can have food. So if you're in the area, please do stop by. I'm hoping that this is going to be an annual thing for them. I'm really excited. This is a very, very cool. So, and thank you to Julie, Trina, Steve, June, and Nancy for being supportive of this as well. So the second thing you guys have is a holiday hope donation drive. This is the third or the fourth year that I've come to ask you guys to. I've already gotten money out of it.
We've only been here 3 times, so I think.
I didn't do any work. Lydia and Emily, one of my pharmacists and technicians, did all the work. They had a nachos/bake sale today. It was very well attended by folks coming and supporting it, as well as a bunch of people from all of the different areas that provided goodies. We had goodies from nursing admin, from the foundation, from radiology. Andrew's dad, our recruiter, made some brownies or some cookies. My mother made brownies. Cath Lab, EBS, medical staff office, lab made a whole ton, but the point is there was donations not only for in support of the day and the food themselves, but they also provided food that we could sell. So we are currently sitting at 13,100 and we gave some money, so $49.93. Our initial goal was 250 kids at $50 a kid. So that is 263 kids. And we're gonna push to, Katie's not here, I wish she was here. It's her, she's on the board for the Center for Children, for families. So we're gonna try to hit 300 kids this year. And I think we're probably gonna hit that. Dr. Brady just left, but the medical staff is one of the big reasons we're at that $13,000. They voted last night to support our fundraising with $7,500. So, Tony, I think what you missed, because I was bragging to Marcus and Joe right before you got here, is the bake sale that they just had raised just under $3,000. Just with the bake sale between Venmo and the cash that we had. So all of you guys supported that are here in the room. I appreciate it. So thank you very much. And please come. It's December the 13th from 9 to 11. We're gonna have Santa Claus and hot chocolate and cookies. And if anyone who is on the line who's not here, if they would like to donate, you can donate through the foundation and just put a note that it's for Holiday Hope. Thank you.
Thank you. Okay. Anyone else wishing to speak on items not on tonight's agenda? Okay, I'll go online now. Anyone online wishing to speak on items not on tonight's agenda?
Don't have online.
Okay, I'll close down the public comment and I will bring it back to the board for any comments for board members before we get started on tonight's hospital agenda. Or I'm sorry, meeting. So, no. Okay, seeing none, I'll close down the comments from the board members and we'll move on to the consent calendar. We have 2 items tonight, and it is the minutes approval for September for our meeting in September, October 29th, and also our policies, policy summary approval for November 2025. Is there any questions from the board about either of these two items before I open up for public comment? Okay, seeing none, then I will open it up to public comment for the consent calendar. Any raised hands online wishing to speak on this item? Okay, seeing none, anyone in public wishing to speak on these items? Okay, seeing none, I'll close down the public comment and I will entertain a appropriate motion from the board on today's consent calendar.
Move acceptance. A second.
That was Director Gallagher and Pimentel, correct?
Correct.
Thank you. I'll take roll on this item. Director Creel,
Yes.
Director Gallagher,
Yes.
Director Pimentel,
Yes.
Director Cox is absent, and Chair Jenkins.
Yes. Okay, so now we'll move on now to our discussion items. We have two items for tonight. Just want to make an announcement that we typically receive a CFO report and a budget update, but because we are having the meeting a week early, we won't have that. We'll get a look at the financials for October and a little bit of November, I would imagine, for the budget at our future meeting in December. Tonight, we do have item number 3 is the Medical Executive Committee's report approval for November 2025. This is the report that we just received in closed session from Dr. O'Grady, the Chief Staff for the Medical Executive Committee. Are there any questions from the board about this item before I open it up for public comment? Okay, seeing none, I'll now open up to public comment for item number 3. Anyone online wishing to speak on this item?
No hands online.
Okay, anyone in person? Okay. I'll close down the public comment, bring it back to the board for an appropriate motion on item number 3.
Move approval. Second.
Thank you, Directors Gallagher and Pimentel. I'll take a roll on this item. Director Creel,
Yes.
Director Gallagher,
Yes.
Director Pimentel,
Yes.
Director Cox is absent, and Chair Jenkins.
Yes, thank you. We'll move on to item number 4. This is the Chief Executive Officer report. Steve, whenever you're ready.
Thank you, Tony. Appreciate it. I'm going to give some couple of local updates and then some high-level federal type updates so we can get a sense of where we're at in the world of healthcare politics. But to start, that being shared.
Thank you. You're ready now.
Awesome. So Center for Medicare and Medicaid Services has a value-based purchasing program where we get paid, a portion of our payments are based on our quality and our patient experience. So these are publicly available data for all hospitals. And based on how well we perform, we could get a financial penalty in our payments for Medicare patients, or we could get a boost to our payments. And so over the last couple of years, federal fiscal year 24, we actually had a penalty of $195,500. Federal fiscal year 25, we had a penalty of $172,000. And in federal fiscal year 26, which is going to start impacting our payments, we will actually have a net benefit on these payments based on really all of the factors: patient experience, clinical outcomes, Medicare spending per beneficiary, readmission rates, and hospital-acquired conditions improving over the last couple of years. These numbers, as I say at the bottom, typically based on patient care data that was from 1 or 2 years prior. So federal fiscal year 26 is usually going to be 23, 24, 25 data, patient care data. So this is very good news. This is another indicator, and this kind of rolls along with the next thing, which is our leapfrog journey, right? So these things all correlate with each other. As leapfrog scores, patient experience scores improve, then the financial picture on value-based purchasing improves too. So this is, we did get our fall 2025 score. It is still a B, but it is higher by about 1/10 of a point than we were last year. So we're that much closer, 3.15 compared to a The A threshold is just over 3.2. So we still, quality department and nursing and medical staff, we have the gap plan to know how we get to that A, and we'll continue to climb this ladder, but it's a great trajectory from 23 when we had a D. So we continue to be really proud of that. And this is really funny, Tony and I had this experience today. Every time we show this, people clap. Doesn't mean you have to now. Yeah. That's the response we get out of the community when we are talking about having not D to a B in a couple of years. So that's always fun. This is also publicly available on the Leapfrog Group website. You can see who else we're in the category with. So these are the hospitals within 40 miles of us that also have a Leapfrog score. You might notice that, any hospitals that you're thinking of that are not on this list, it's possibly because they don't self-report. So the Leapfrog scores are based on publicly available data as well as self-reported data. And so these are the A's and the B's and the C's. There are no D's within 40 miles of us. So this is where everybody is based on. So we're in the category with Kaiser San Jose, El Camino Los Gatos, O'Connor, and Kaiser Fremont. Less fun is pictures that Robin sent me. Thanks, Robin, and the engineers. The hospital roof is fine, knock on wood, but these are the roofs of the medical office buildings, ambulatory care buildings are on the older side, and the air handlers are also on the older side. So the rains and the roof are, as I say on the slide, telling us what we should spend our measure and dollars on next. So we will definitely have some infrastructure improvements that we'll be prioritizing over the next few months with the remaining tranche 1 bond dollars that we have to make sure that we can get some of these things taken care of, because we are leaking into some important places and we want to make sure we stop that. Okay, on to some federal stuff. So the federal government shutdown, longest in history, hurrah for us. It did end, and some of the things that ending the government shutdown did was it stopped the proposed disproportionate share dish cuts. This doesn't mean they're eliminated forever. It means they're postponed until the next time that they come up, but it does put them off a little bit. And that sort of keeps happening with those dish cuts, and we'll try to keep lobbying for that continuing to happen and those cuts not happen. The 4% Medicare sequestration cuts do not need to take effect in January. We are still probably getting a 2% Medicare cut, at least it's not 4 as a result of the bill. So that's going to be a slight benefit in our budget for next year, not huge, but it'll be a little bit. It does bring CMS workers back to work so that they can keep moving the hospital fee program 9 or clock 9 process along. And CMS actually did offer some preliminary guidance on those programs earlier this week, which is really an indication that they're starting to engage with the state of California and others on the hospital fee program. And so under that interpretation from earlier this week, beginning in October of 26, a program size would be capped at the level of fees that were in effect as of July 4th, 2025, when the bill was signed. So for California, that refers to QAF 8. Now, this still doesn't resolve the question of whether QAF 9 could get its approved increase or not, or its proposed increase by the state or not. This is not a settled question yet. The feds may argue it one way, the state is going to argue it. Well, we've had that program in since well before the bill was signed. When I say that program, I mean program 9, has been in since well before the bill was signed, and that should still move forward. We still obviously don't know the timing of the approval of QAF 9, and they're starting to collect and ask about data for QAF 10. And so we really have no idea what the first 9 months of that are gonna look like, because those are based on calendar year 2026 data. So all of this is to say that it's moving along and we still don't know. And our consultant continues to tell us highly unlikely that we'll know before the end of the year. The last topic is the Rural Health Transformation Program. So you'll recall I have talked about this in previous meetings earlier this month. The state submitted its application for California's share of the $50 billion in funding that's available through the Rural Health Transformation Program. You'll remember that in the big bill, HR1 cut $1 trillion out of Medicaid and then gave 50 billion back and said, look at this great thing we're doing. We're giving $50 billion to rural health. So California has its application in. The state would receive as much as 500 million over 5 years, so 100 million a year. No guarantee on any of the discretionary funding. And just we should hear, or at least the state should hear decisions by the end of the year. And that will then trigger the state saying, okay, we've got 100 million or 102 million or whatever it is that they have to distribute among providers in this state. What are they going to do with that? They've outlined their key priorities. And I highlighted key priority number 2, because I feel like we fit right into that one. Stabilization of rural providers as a means to maintain anchor institutions where transformation can take place, including sustainability payments. So that is us. We are an anchor institution in a rural community and are looking for those continued sustainability payments. So we are continuing to have conversations with our elected officials in Sacramento to make sure that we are on the list when the time comes for them to have that conversation. We will continue to push on that until we know what the outcome is. I'll let Trina do hers and then we can take questions together, if that's all right.
Yeah, sounds good.
All right, so our postpartum hemorrhage is one area that was identified that we had some areas of opportunity to improve upon. And so our maternal child health and our emergency department staff have a work group that have been working together to review policies, looking at how we treat postpartum hemorrhage in the emergency room. And so they've done a lot of work to improve this area. And soon we probably will be adding on a code OB in our emergency room that will improve our collaboration of care between the specialty of the OB nurses coming down and helping assess the patients in the emergency room. So that's one really good thing that they're working on now. And another thing that the ED educator's been working on also is the pediatric scoring tool, which helps the ED staff, the nursing staff, as well as the ED providers identify quickly which pediatric patients are, in respiratory distress. So it's a scoring tool they use looking at a variable of things, O2 saturation, lung sounds, retractions, respiratory rate, and they can quickly give a score to that child and, helps us quickly identify. So that's been a very positive, tool that's been introduced into the emergency department as well to improve care. Our inaugural communications committee meeting, I did announce last month that one of the goals was to improve communication throughout the hospital. And we did have our inaugural meeting. It was multidisciplinary. We had over 26 attendees, multiple items. What we did was we broke it down and identified areas of communication that were high, moderate and low priority. And our next meeting will focus more on the resources and the tools that we currently have, and then kind of identifying what tools or resources could be best utilized for those different areas to improve our communication. But I think it was well received, and a very productive meeting, so I look forward to the next one. For volunteers, I just wanted to say, what a great committed group, and we're lucky to have them. And I just want to share kind of a quick story that Dr. Haverlack shared in the emergency department meeting, that one of our volunteers was in the emergency department with their loved one who was getting care. And while she was there, she was actually sitting in the emergency department in the hallway, taking note about how the volunteers could help make the emergency department more efficient. And I just thought, here in a time where she's worried about a loved one, she was there trying to also problem solve and help, our community and the hospital. So I just think that speaks volumes to how lucky we are to have them. Next, MRI update. We did have a online meeting with CDPH. We were provided with a long list of items that we needed to secure, including multiple policies that they wanted for our MRI trailer. We have most of those items completed. We're just down to the last couple items. Developing policies takes time. And so we are hoping to have all of those by next week. So once we have all those items and we submit them to them online, then once they approve those items, they will then schedule our site survey. So we're hoping we are making progress, and we're hoping that will be sooner than later. For the executive leadership rounding, this is something that we're going to start doing. I think that there's a lot of white papers on this and how it promotes psychological safety for staff. It promotes collaborative problem solving, and also helps the staff feel recognized and valued. And so all of those things help promote a healthy and a positive work culture. And so that will be something I will be reporting out to you guys in the future for future meetings, some of those results. And then security is the last update, and that is, we did have kind of a mass exodus of our security guards. We have hired almost the same amount that have left. It has caused us to do some creative staffing to, make sure that these patients are getting the same level of care that they need. And so if you've heard anything about that, we have been having several meetings and working towards getting this situation stabilized.
And this is with a contractor. Security is a contracted service, they're not employees of ours.
And that's all the updates I have.
Please.
In terms of the postpartum hemorrhage, so somebody, or these are people who've gone home and then experienced their postpartum hemorrhage and came back to the ER, or is the ER involved on the second floor when someone has?
This is like patients that come through the ER, and just, we did have a patient that came in and we were able to identify some areas of opportunity of where we could grow.
Okay,
And so with the collaboration of the OB department and the
Sure.
emergency department leadership and staff, they have developed a work group and with education, and they've done some really nice work on this.
did the patient deliver here or elsewhere and just? was it
Patient
here?
delivered elsewhere and then came
Good enough.
in.
Thanks.
Anything else, Jim?
No, thank you.
Alex, I can't see you, but any questions for Steve or Trina for the report?
No, not right now. Thank you, though.
Marcus?
No, just gratitude. It's hard for me to imagine your day job right now, but I appreciate how you're doing it. No, seriously, thank you for what you're bringing to this and a focus on communication and bringing our teams together. I know every word probably represents about 5 hours of work behind the scenes, so just thank you.
Thank you.
For Trina, for the executive leadership rounding, what does that look like? Or I guess what's the vision behind that in terms of stops and people who are involved within those rounds?
I do rounding now. I'm out there at least twice a week. I try to get out there at least 3 times a week and just go through all the different departments. This will be a little bit more formal, if you will, and that I will have a tool of questions that will be the same questions that I'll ask staff every time. Some of that, some of them are, do you have the tools to do your job? What type of feedback do you receive from your leadership, from patients or staff? Is there anybody they would like to recognize? It's about 6, 7 questions long. And so with that, that will help us identify other areas where we can maybe remove barriers or assist in whatever challenges they're having.
Yeah, I was gonna ask if there was gonna be like a consistent way to track how those interactions go and that sort of stuff to see where we're improving and that type of stuff. So that's great. I'm really happy about that. Any other questions for Trina or for Steve for either of the reports?
I'll ask about, thank you for sharing the roof, and maybe this is at one point in time, but I might be crossing my day job. I was a volunteer in this one, but the facility condition study on not just like these roof shops, but like, do we have a pretty strong understanding of what's next? These feel like, important projects to hit, but I trust that you'll let us know what's next.
Yeah, we've got, I've been meeting with Robin and the engineers to look at the project list. There's limited funding available right now from Measure M Tranche 1, right? We obviously purchased the property and then we're doing the radiology, and what's left is not gonna be able to do all of the infrastructure deferred maintenance stuff that we'd like to do. So we're trying to get quotes, have good understanding of what each is gonna cost so that we can prioritize, say, okay, we could do these 4 now, and the rest are gonna have to wait till 27 or whenever we get the next tranche. But so that some of regulatory joint commission is driving some of that. The roof, like I said, is probably driving some of that. And the rest of it is gonna be the engineers, really telling us like, we gotta fix this first. Because we're having a lot of those conversations right now. Because it's, stuff that hasn't been invested in a long time.
Yeah. And then, Steve, I don't know if you have this, I think my only question for you is the exact language for the QAF 9, how they were treating it. Was that like a direct quote you would put up there as of July 4th, or is there like that?
Yeah, I pulled that out of the California Hospitals Association summary of what came from CMS.
Okay, cool, good to know. I don't think I have any other questions.
Maybe we should acknowledge where you started, and we should be standing up and applauding.
Please do.
But we expect this level of improvement, so it's very cool that we're that close to A, and that our plan is there, and that all our efforts over the years are succeeding. So getting back to leapfrog and the federal bonus money we're getting now.
Right.
So this is great. Thank you for
Yeah, that's great.
Yeah.
Absolutely.
Yeah, it was, Steve and I presented at Watsonville Rotary today. Got a round of applause for that and for the Google ratings as well.
Yeah.
We were very happy. As I told Steve and another person we were talking to, every time we present at these meetings, someone comes up to me or raises their hand immediately after I talk about Watsonville Community Hospital and they will say, I was just there and I received great care, or someone that I know was just there, someone within the family, a loved one was just there and they received great care. And so it's great to see that realized in all of these rankings and all of these other things as well. So, okay. So I do want to open up for public comment on item number 4, as I usually do. Any raised hands online, anyone online wishing to speak on item number 4?
That's online.
Okay, anyone in person? Okay, seeing none, I'll close down the public comment and, I will also adjourn the Watsonville Community Hospital Board meeting.